All right, welcome to HIVE Nurse, Inside the Hive. I'm Ashley Kellish, excited to share a lot of different ways to enhance our profession today.
Yeah, and I'm Elizabeth Walters, and I'm excited to be sitting here today.
Well, we're happy to be here together, and we are very happy to try and uncover some different ways that our teams out there are managing what we've been talking a lot about lately in our profession, burnout, moral injury, etc. So today we're going to focus on how we can take burnout and exhaustion and the cynicism and maybe turn it into something good.
Wait, we're not getting rid of cynicism, right?
No, you can still be as cynical as you need to.
Okay, good.
But I will be there on the ready
with the rainbows and
the
butterflies
positive innovation,
and the unicorns for sure.
The glass half full.
Yeah,
so I like to live.
I'll be at the glasses present.
Yes. So I think the glass is present. Perfect for us.
It's real.
So I think the key thing is to note around here that burnout is a real thing. We've talked about some of the evidence in other episodes. You've got any more facts for us around burnout today?
I have some facts for sure. Lots of facts because we're nerds.
Yes.
But surveys show up to 65% of nurses reporting being stressed and burned out. So that's the backdrop we're working with. I think we've spit that fact earlier. There was a 2025 review that found peer support, both formal and informal, strengthens belonging, identity, and resilience. Okay. And the U.S. Surgeon General has even named connection and community as one of the 5 essentials for workplace mental health.
Do you know that relational leadership is all based on building connections?
I do, but it's also about snapping.
And forming community.
And hugging.
When you get past that part, it's definitely something that helps guide us through all of this. And, it's true. You know what? We laugh about sort of the snapping and the connections, but some of the most healing things are in those moments of caring that we give to each other, right? Like maybe a little note across your desk that says, hey, want to get lunch later, right? Those kinds of things.
You're seriously writing notes?
Yes.
And sending them to people?
Yes, I do. I like to write all
Don't
of my
give
notes.
me a piece of paper in the middle of the shift.
I will email you or I will text you.
You text me and it'll come on my Apple Watch. Yeah. Like if you hand me a piece of paper, I'm going to think it's probably like a pink slip or a parking ticket. Nobody does anything on paper anymore, guys.
Except for me.
Yeah.
With my pen.
Her pen and paper.
It's so true. But I mean, truly, these are the moments, right? Even knowing me for who I am with my paper and me knowing that paper is not your friend. I think that's important on how we work through
clutters the environment.
Yes, but I think there are some really powerful moments that are out there today of some of our teams breaking through, this emotional exhaustion. And I mean, I was reading actually in one of my journals this week.
She gets journals in the mail still.
I love them. I really do. My notebooks and my journals. But there was a whole story on the nurse as entrepreneur, because I think we're seeing today so many people that are saying, how can I make the profession better? And how can I use innovative strategies to get there?
Yeah, totes.
I think of a simple time when I started thinking differently and said, I'm not going to just live with this type of moral injury and burnout anymore. And you want to know what it was related to?
Rainbows?
No. Breast milk.
That's also on brand for her.
Not my breast milk. Other people's breast milk.
She has 4 kids, by the way, friends.
There's been a lot of breast milk in my life. But no, seriously, I was a manager, and I was working with this team, and, it was new in my time with them, and they were definitely struggling. Numbers were low, all this.
Yeah.
So a simple task comes across my desk. Change the way we store breast milk. No problem. Got this, right?
Yeah,
so I go out, I figure it out. I realize our refrigerators aren't correct for breast milk. So I go and work with other parts of the hospital. And I think this is easy fix. Well, the more I started talking about it.
Nothing's easy in healthcare.
Nothing is easy. No, I should have known that from the beginning, but I learn every day. But all these people kept coming up to me and telling me all these additional problems that were happening with breast milk. We weren't documenting it appropriately. Mistakes were happening that we weren't catching or uncovering. Oh, yeah.
Ooh, that's like giving somebody the wrong blood.
Yes. It was very powerful things, but they had been really withholding a lot of this information because they were always afraid they were going to get in trouble. So what a simple thing turned into this opportunity for me to show them that, hey, I'm not here to punish you. I'm not here to add more moral injury. Let's get this right. And so we worked through the entire breast milk process. We got it right. But what I kept thinking, it sort of broke me a little bit, because all I kept thinking to myself is, if they're hiding all this about breast milk, what else are they hiding?
Oh, yeah.
Right? Like what other things are they not holding?
Stool samples.
Who knows? Not stool samples. But truly,
They have a special cabinet in the back.
Yes, and they're not sending them.
They're not
delivery.
sending them.
I mean, who knows?
So gross.
What?
That's what the smell in the unit is.
Oh my gosh.
It's not cleaner.
Gracious.
It's the hidden stool samples.
But in all actuality, right? Like if they're not able to talk to me about that stuff, how could I ever innovate? And so that was my first approach at trying to do things differently and really work with these teams to help get to the other side of moral injury and help us build a better system, at least in my area of control.
Yeah. I have also an example of the way that the system is broken a little bit. So y'all know that I'm a nurse practitioner. I actively practice. I have my patients that I take care of. And
very well.
I got an electronic alert about a discharge of one of my patients who I used to see all the time. And I was like, I wonder where she's been. She hasn't been like hanging out. She hasn't come to clinic in a while. It had been about 6 months. Come to find out, she was in a terrible accident and had been in the hospital for several months in the intensive care unit. And the only reason I was alerted, I was seeing this patient probably like 2 to 6 times every quarter to help manage their chronic pain. And, come to find out she'd had this terrible accident. She had a trach. She was essentially paralyzed. And I found out through a discharge summary. And I was really mad about it. I was like, nobody could have picked up the phone and called me when they saw that I was this like recurrent provider taking care of the patient. I was not notified in any way, shape, or form. They'll
call you if you don't document in time.
They will. If I didn't close my notes on her and charge her and bill her for my services, I would have gotten a phone call from probably like 10 layers of leadership.
Right.
But no, nobody called. Nobody said anything. And I found out through a discharge summary. And I'm going to tell you, it wrecked me. I had to get on the phone and debrief with the colleague who also knew the patient and, talk about like, how did this happen? How did we not get notified? How are we not in the loop, right? And so I think that's one of the things that, it was definitely a breakthrough. At the end of the call, when I debriefed with my colleague, I felt better and I felt, like I'm not at fault here and, things are okay and that we're all on the same team. So, that breakthrough was just that we're not all alone.
No, and I think we're highlighting a lot of things too here that there's psychological safety that has to be present in order to even bring up things that are challenging or not working. In your instance, it's the guilt and the shame that you feel if something doesn't go according to plan, and then you carry that with you as you go, right?
Exactly.
And these are all the things that I think have led many of us in this profession to start saying, how do we think differently? How do we change how it feels to work in this environment? How do we create spaces where that you get a phone call, you get a trigger somehow in the electronic medical record, or if something isn't going well with my team and mistakes are happening, that I'm made aware so that I can help them.
Right.
That's what we have to work through.
And there's like tons of examples of nurses who are doing this work, right? There's tons of nurses across the profession that we're seeing grassroots solutions every day. Some of the things that we have done, we've worked together for almost 15 years.
It's a long time.
Like too many years. We've known each other.
Yeah.
But we used to have a lunch bunch. Remember? We used to go out to lunch
with our other people.
It was an interdisciplinary lunch bunch.
Yes,
so that was really cool. But, we would just meet like a quarterly and have an hour and a half to just vent and let it go.
I think even I brought my kids one time because I didn't want to miss it and they had fevers. I hope I didn't get you all sick.
She did.
But I didn't want to miss it because it was my time.
It was that important, right? Yes. We talk about mentorship moments. I'm a big fan of nurse talk. I love to do, you guys know I'm a doom scroller. And so I love to doom scroll in the nurse talk land. I love to hear what these influencers are saying. I love to laugh about it.
Yes,
that's super fun. And then there's some other national grassroots programs that are built by nurses for nurses. One that I really want to call out today is Operation Happy Nurse. It is a free.
I haven't heard of that.
Yeah.
Well, cool.
Okay.
Writing it down.
She is Operation Happy Nurse. No, she's not really, but Anyway, but it's a free online space for decompressing and connecting. If once you're in the platform, it's just for nurses. It actually asks for your nursing license before your nursing license number.
Oh,
and
wow.
you kind of go through and, they have like some exercise stuff. That's more her style, less mine. But also just
Something
a lot
for
of
everyone.
like chatty, sort of feels like a social media just for nurses, which is kind of cool. There's also this really great new program called Don't Clock Out, which is a weekly peer support group that fights isolation through storytelling. So Don't Clock Out is all about reducing suicidal ideation and suicides in the healthcare industry. They actually even have produced a movie, which I'm hoping to get to one of their live screenings. So this is a really, really great opportunity. And these are nurses that are like, recognize this problem and we need to do something to fix it.
Yeah. And imagine if our organizations, because, not everyone can go out and do things like that either. But what if our organizations let us innovate like this and think differently, right? And
yeah.
I have a great story of these two colleagues that I got to know just briefly. They're both actually health and wellness coaches, specifically for nursing. They used to work in the United States. Their hospital let them, their sisters, their hospital let them build this entire program for their teams.
That's amazing.
And then the day they went to launch it, they said, "Oh no, you can't. You have to staff. You can't. You don't have time to do that." And this happened multiple times. So they had everything ready to go, and they were never allowed to launch. So you know what they did? They left and they launched it themselves, completely separately. And this is what happens when our organizations don't create the environment where you can bring this innovation to the forefront.
Yeah.
Like the breast milk. If I didn't ask and get their feedback and innovate how we did things, we'd still be making errors around that.
Yeah,
it's true.
Just like blood. It's terrible if you mix up breast milk.
Yeah, you don't want to do that.
It's the end of the world, especially for the infection prevention nurses.
Yes.
Well, do you have any tips for us today?
Well, I will say from a leader perspective, this is what I work the hardest on, is creating environments that are psychologically safe, meaning that people can speak up and share what's going wrong, what's not working, and what ideas they have. Doesn't mean their ideas are always going to win, by the way. It just means that they're allowed to speak up.
Every once in a while, I have a loser idea.
Just maybe.
It's like
I can't even recall.
1 in 100.
But truly, not every idea has to win, but you have to be able to speak up. In fact, there's so much evidence out there that supports this. There's a topic I always talk about. It's called Project Aristotle. Google did this study in 2014 to 2017.
We trust it because it's on Google.
I do. They know everything about me. They know where I like to shop and eat and all the like. So, yes. But so they looked at 160 teams for several years to find out, okay, what is the best recipe for a team?
Yeah.
And
what
guess
was
the
it?
one thing they found? Psychological safety.
Oh, I was going to say rainbows and pizza parties.
No rainbows in sight. No, truly, the teams that had people in it that allowed them all to speak up were the most productive. So those are the teams that we can create, and we can innovate in our own spaces, and we can make patient care better when we allow people to innovate in those spaces.
Yeah. And, for us practicing nurses and NPs, don't underestimate your voice. You got to speak up, right? Like It's like your two friends who did all this work, and it's like right from the very beginning, like what kind of time release am I going to get for this? Like, are you going to be supporting this financially, right? Like this also leads to burnout, right?
Yeah,
so
absolutely.
Having what is seemingly feels like support, but then no financial backing behind it also hurts a lot.
Yes. And, I think ultimately this is about culture change, and it's culture change at our organizations and in our profession, right? We have to raise the bar for our profession, and we have to recognize that we deserve this kind of respect and psychological safety when it comes down to it. And
peer support, the opportunity for formal peer support programs as well as those informal
lunch bunches.
That was so fun. Yeah, I miss doing that.
It was fun.
Yeah.
One more story, because I think culture change is important. And also we have to hone in on the fact that this is what makes patient care better. So as I was working with these teams that I was managing and growing to be a better leader and a better manager, creating these psychologically safe spaces, we came across a group of patients that had SMA. They had this at birth, and they were supposed to be given a medication that would help them learn how to walk. Well, we found out during the whole process that if they received the medication while they were either inpatient or outpatient, one or the other, it was going to cost families over $150,000 per dose because it was a new medication on the market just approved by the FDA. Well, long story short, because I created environments where we could innovate, we found a way to do this in both the inpatient and outpatient environment. The patient was safe and it cost the families nothing. Insurance covered all of it. But had I just accepted what it was and not created this environment where anesthesia and nursing and physicians could all come in a room together and speak up, we wouldn't have innovated. Yeah. So it's at every single level of what we do that when we have that ability and we build in these conversations and this peer support and this psychological safety, we really create environments where we can thrive.
Yeah, totally. That's what Hive Nurse is all about, right?
That is
thriving.
Yes.
Yeah. Thriving
Helping
in our environment.
Implement viable ecosystems.
Yes, totally.
And that's how we do it.
All right. Well, thanks everybody for coming today or listening to our podcast today. Remember to follow us on all the socials, the Faceplace, the
Market Book, the Instagram.
The Instacart. Were you going to say Instacart? Follow us on Instacart. We will deliver your groceries. Don't worry about it. But we would love to see you guys and let us know all the things.
Thanks for joining us here on Hive Nurse.
Bye.
Bye.
Instacart.
I did almost say Instacart.
I know, because you buy all your groceries
every
on
day.
Instacart.
I have like a whole